Obviously, there's multiple headaches, and from my mind, as far as migraines are concerned, one, they got to be diagnosed correctly. So we see a lot of people that believe they have migraines, and we can help them a lot with therapy. The biggest, in the literature, people who truly have migraines, the pain typically starts in the front and radiates back. Okay, and then there's the people that I think that was 90% of the people that studied in this one group. In another literature, 75% of the patients who had cervicogenic headache, it started in the back and radiated forward. And so the key is the trick is diagnosing, is it musculoskeletal, what's the issue? And so the point is you can have movement dysfunction that may contribute to a lot of things. So we treat the dysfunction as far as the mechanics, but we don't necessarily know, did that take pressure off the artery? Did that alleviate a muscle spindle or something that stopped referring pain? And so we have a lot of success in correcting how people are moving, specifically in the neck and in the shoulder girdle, so that they don't have stress and things like that. And we also think of it as, if people do have migraines, you think of them as being multifactorial. The musculoskeletal stuff could be one of the triggers that sets off the cascade. And so we try and reduce the triggers, which will reduce the frequency, hopefully reduce the frequency of migraines.
A lot of people, by definition, have multiple headache types. And then those even who only have one headache type, if they have migraine, they can get muscle spasm and tension due to the migraine, or they can have unrelated muscle spasm and tension, which can then trigger the migraines. So it's a whole integrated picture that can't be really parsed out and say, well, that guy has tension headaches and that one has only cluster, because very frequently they all overlap. We find the best success seems to be treating all the problems that are going on that are contributing.